Hi, Dr. Ahadian here. The topic of discussion again is ADHD and ADD with the idea of the attention deficit disorder with hyperactivity and attention deficit disorder without hyperactivity. Again, because the school season is beginning again, the information and ability to have knowledge about the manifestation of attention deficit disorder with or without hyperactivity is very important, specifically when we want to differentiate between the attention deficit disorder and problems related with bipolar disorder and manic disorder and severe behavioral problems. Now, there is a lot of problems related with the combination of bipolar disorder in children with attention deficit disorder and learning difficulties, which are all combined and express itself in a situation related with inability to concentrate, inability to sit still, inability to have attention towards the academic year. Now, differentiating that is very important, because if we just go ahead and give medication to see a child who is hyperactive and not really realize the intricacies of the behavior and the problems related with the familial behavior, interaction between mother and father, the psychiatric problems and issues related inherent in father and in mother of that child, and also the communication and the relationship between the children in the family. How many children in the family exist? Is it the only child? Is it the older child? Is it the middle child? Is it the third child? Is it the combination between all sons, or all one son and all girls? And a lot of combination that has to be involved and to be taken into consideration. Now, after having that and after differentiating that, going to the background history and issue with regard to genetic factors and factors related to biological inherited issues that are very prevalent, according to my opinion, in the families, basically as far as genetic transmission of all the disorders based on personality and biological issues, according to my opinion, basically very strong linkage genetically, and therefore by getting background history in the family history and history of the siblings, the cousins, the related issues in the background of the child, we can have a very good diagnosis and understand the situation with regard to attention deficit disorder diagnosis, or a precursor to the biological aspect of the bipolar and unstable mood disorder. Now, when we talk about bipolar disorder, it doesn't mean that it has to go through a manic depression. A patient has to be manic for 6 months and then depressed for another 6. There are different subcategories of bipolar disorder, with one of the very important ones, atypical bipolar disorder. Atypical bipolar disorder is a bipolar condition in which we see a lot of mood instabilization on a rapid cycling basis. Basically, we have ultra rapid cycling base bipolar disorder, or a rapid cycling bipolar disorder. We have in people who have their moods are very different during the course of the day and during the course of the week, so we can go up and down like a yo-yo type of kind of thing, and very interesting disorder to keep in mind. Now, differentiating that and then getting to the core diagnosis of attention deficit disorder, and then again a stimulant medication to be used for the attention deficit disorder to correct the problems that are going in combination of family therapy and supportive therapy to deal and to work through the problems that the child is going through, adjusting to school system, adjusting to the family system, adjusting to cousins, adjusting to the whole gamut of the issues as we can imagine, which is out of the realm of this conversation. And again, I hope that this will be very informative, especially right now that people are going to school again, college, universities, all that in the beginning of autumn, and to keep that in mind about our children, our loved ones, our friends. If you want to give them referral for what's going on with them, and don't send them, okay, you have ADD, go and take medication, or just coming and saying, well, my child is hyperactive and therefore I want to have a stimulant medication, which could cause a lot of other complications if it's not diagnosed correctly and treated appropriately.